statistics are really incredible. In some cases, people just miles from one another have exorbitantly different outcomes when it comes to life expectancy, when it comes to healthcare, when it comes to outcomes. Where do we begin to change policy to try to fix this?
Yeah, thanks for having me today, Vonnie. Well, one thing we can do is really prioritize health equity. And what that means is that we are ensuring the conditions through which every single person in this country can be as healthy as possible. And that means really looking at what we think of as those social factors that might contribute to these differences in health outcomes. And that relates to access to healthcare, access to education. We know how important education is in terms of quality for health, access to good jobs, access to transportation. So by targeting policies that address these factors, I believe we can really make a difference in closing those gaps.
What are the 2 or 3 things that really hit home the most when it comes to the data that you've access to and what you see from it?
Well, let me tell you about one project we have. We've been focusing a lot on physical activity, particularly for kids. We know in this country that only 1 out of every 4 children meets the daily recommended levels of physical activity, and that's 60 minutes of activity per day. So we're talking about 1 hour a day, and only 1 in 4 kids is actually getting that level of activity. So it's a problem, and we know that there's differences by where a kid lives, by their income in terms of their family, by race, by ethnicity, and all of these factors can be addressed by promoting policies that address those circumstances by which kids are unable to be physically active.
So, Dr. Pollack Porter, what do we do? Because it sounds like an overhaul of just the healthcare system alone isn't even enough, and that's a goal that's almost unattainable even right now. But it sounds like this is policy that needs to be across the board.
That's exactly right. We need to focus on all of those factors and sectors that matter when it comes to somebody's health outcomes. And again, that means promoting good access to education, to high quality education, promoting access to transportation so people can get to their doctor appointments, so people can get to grocery stores, so people can get to jobs, promoting changing the environment where people live so that they have access to safe places to walk and bike and be physically active. So it's more than healthcare. Healthcare is a piece of the puzzle, but there are so many other factors we need to focus on.
Now, troublingly, you say that there is ingrained and historical lack of political will to change a lot of what we see in the current data. How does one change that? How do you change an ingrained lack of political will?
I'm really optimistic that change is possible. And what I'm seeing and the kinds of work that we do is we're working with community members. We are working with individuals and encouraging them and supporting them by providing them with the data points, by helping to walk alongside them to hold our policymakers accountable and to demand change. And I think really that's what we're going to have to see more of in order to generate that political will we think is important to lead to changes in health.
Can community organizations or even businesses with their great resources, can they do enough to change statistics? Can individuals do things that might eventually change statistics?
Yes, absolutely. There's a role for everyone in this issue. There's a role for individuals, for businesses, for community organizations. And the work we've been doing with kids, we've been partnering with organizations across the country to help change their environments to promote things called play streets, where they are changing neighborhoods to provide access to safe places for kids to play, maybe during the week for a few hours throughout the summer. By doing this, we are seeing how small investments in communities to provide access to basketballs and jump ropes and to safe places for kids to play are making a huge difference. Our research alone shows that kids get about half of the activity they need if they attend a play street. So that's just one example of how small investments in neighborhoods can help create conditions by which we can have more than 1 in 4 kids being active a day.
Dr. Pollack Porter, explain to us what you mean by upstream. We're not thinking about the upstream enough.
When we think about upstream, we're talking about those factors such as education, housing, neighborhood, all of those factors that might help your health be better or worse depending on where you live or where you work or where you go to school. We think about those downstream factors as more sort of health care and what happens once we actually get sick. I'm talking more about prevention and preventing health, bad health or poor health by making sure people have access to good schools, access to healthy foods, access to places to be active.